Zoom.com helps you say, I love you this Valentine's Day. Zoom.com, I love it.
Ako si Jose Poli. Binabati ko rin ang lahat ng mga tropa sa San Andres Bukid, ang mga kasamahan ko noong araw sa barangay at ang mga kapitbahay doon, lahat ng mga kakilala. At ang ganun din sa probinsya, sa Ruas City, ang mga kamag-anak ko, mga kapatid ko.
Ako si Perla Kakam from Carson, California. Andito kami sa Wilson Park celebrating Chinese New Year. Ako'y bumabati dyan sa ating kababayan sa Manila, sa Pilipinas. Binabati ko kayong lahat dyan. Mahal ko kayong lahat. Lalo na yung Valentine's Day. Habang nandyan ka sa Pilipinas, I love you.
Zoom.com helps you say, I love you this Valentine's Day. Zoom.com, I love it.
And I'm happy that Filipinos are not just excelling in the entertainment field, they are also excelling in the field of science. And we have one of them this afternoon on the show. He was raised in New York City, graduate of Johns Hopkins University, and he went to complete his medical degree from the State University of New York Health Science Center at Brooklyn, graduating magna cum laude. Dr. Carlo Honrado, hello and welcome to Kababayan, LA.
Thank you for having me.
And Dr. Honrado is here joining us to talk to us about a little bit about beauty. In the past, there has been a lot of reports on the dangers of plastic surgery. And now, thank God for science, we are discovering other ways to make us look good, feel better without really doing the surgery, right? Can you tell us a little bit about that?
That's correct, Janelle. Essentially, there's so many things coming out now in the facial plastic or plastic surgery community. Some of it is non-invasive and some of it is invasive. But the biggest push right now is actually non-invasive procedures. And one of the treatments that I have right now is basically something called Ultherapy or Ultherapy.
Okay, what is Ultherapy?
So Ultherapy is using ultrasound to create heat and injury to the lower lying tissue. And essentially what that does is that it actually creates trauma, which creates new collagen. And therefore, once that occurs, you actually get a tightening, a lifting of the face and neck area.
How effective is it? I know that we have pictures of before and after. Can we just show a little bit of that? So can you discuss some of the stuff from these pictures?
Sure, actually. It's actually very effective. The machine was actually approved here in the United States in 2009. It's FDA approved. And as you can
But how is this different from the other procedures? Like some people would think that the invasive ones, the surgical procedures, are going to be more effective and it will last longer, and
Well, that is correct. I mean, with no doubt, with surgery, that, there are longer lasting results. But sometimes people aren't ready for surgery, or they don't want to undergo, anesthesia or have surgery. So having options that are out there that are technically non-invasive but also effective, that's key to maintaining, facial rejuvenation.
Well, this sounds like a good alternative, but tell me, how long before you see the results? So if I go today, when do I see results?
Excellent question. Essentially, with the treatment, you can actually see results then and there. Actually, what I like to do during the treatment is I like to treat the half of the face first.
Oh, okay. Just
show the patient,
right.
Exactly. Show the patient a mirror and actually see the results. Of course, I treat the other side to make it more equal. But essentially, the results take a good 2 to 3 months, even 4 months to get the full effect. Because it takes that amount of time for the collagen to form.
So in just one procedure, because some people, you need like 6 times, or you need to do it 4 times. With this one, Ultherapy, you just need once.
Exactly. A lot of other machines out there require you to have it done like every 6, 8 weeks. Ultherapy treatment, you only need one.
Sounds good. Can anyone have the treatment? Is it safe?
It is safe. Again, when you think of ultrasound, you think of visualizing, babies, in the womb, things like that. So it's actually a very safe technology. The ideal candidate, however, is someone probably in their early 40s to mid-60s. However, I've done elderly, more older individuals with pretty good results.
And I'm assuming there is no downtime for this.
That is correct.
Surgical procedures. All right.
That is correct.
Well, thank you so much for joining us and explaining this to us. Sounds like a good thing to try out for people out there. If you want to call them, that's the number on the screen for appointments, and they are also available online, drandrado.com.
That's correct.
Thank you so much, and more power to you.
Great.
We will be back for more on Kababayan LA. Don't go away.